Hi everybody, I am Dr. Sura Alhassan. I am a dentist. I have master degree in public health, also high diploma in dental implantology. Currently, I am PhD candidate in public health sciences. My lecture with title of the effectiveness of self-care protocol in managing pain in temporomandibular joint disorder patient. It is a scope review as the breadth and extent of my work are somewhat narrow in scope, and this review actually has evaluated one specific type of intervention, which is self care protocol in temporomandibular joint disorder patients. Temporomandibular disorders are interrelated mucoskeletal diseases usually involve masticatory muscles, temporomandibular joint, and other bony structures. Temporomandibular diseases characterized by pain and limitation in jaw function, such as chewing and speaking, and this may lead to reduce the patient quality of life. The intensity, psychosocial profile, and how we use the health services resources are all confirmed that temporomandibular diseases are chronic in nature, which may need multiple approaches to treat or deal with them. This is theoretical framework for non-methods that are used to manage temporomandibular pain. This review is concerned with this non-invasive method, which is self-care protocol. Temporomandibular disorders are a group of diseases and they affect multiple structures. The pain is the main symptom for temporomandibular diseases, and this pain affects 54% of patients with complaint of headache, lower back pain, jaw pain, and neck pain. And unfortunately, this pain is aggravated by doing any normal function with jaw as mastication or speaking. In addition to that, temporomandibular diseases cause limited jaw movement. Finally, most of the time, temporomandibular diseases present with overlapping features with other disorders such as fibromyalgia. 4% of adults have developed conferred painful type of temporomandibular disorders. This percentage has increased annually and with age from 2.5 in 18 years old to 4.5% in 35. While in adolescence, the annual incidence of temporomandibular diseases is 3%. Actually, the young female were at high risk for painful temporomandibular diseases nearly by odds ratio 2. The rationale of this review topic that painful temporomandibular disease or diseases are biopsychosocial and multifactorial in nature. Thus, a single cause is unlikely to be identified in any given patient. Temporomandibular disease pain is a major driver for seeking treatment, healthcare cost, and reduced quality of life. In spite of that the surgical intervention could have better outcome than non-surgical methods to manage temporomandibular joint pain, but the clinical trial to confirm such claims are not present yet. Thus, the biopsychosocial approach has been advocated in recent studies because this approach offers equal emphasis on treatment of physiological, psychological, and social factors which may result in substantial improvement in temporomandibular joint pain. In the beginning, it is essential to understand signs and symptoms, and biopsychosocial aspect of temporomandibular diseases in order to choose the right temporomandibular joint pain management method. But the recent concentration squarely on non-invasive, irreversible temporomandibular joint management method, which is the core of it, is the self-care protocol. Self-care protocol may be what is just need to manage temporomandibular joint pain. Self-care protocol is effective in 60% to 90% to manage temporomandibular joint pain, and these percentages may become higher if this protocol is combined with other management methods. The main components of self-care protocol, we have patient education, self-exercise, therapy, diet and nutrition, and how to masticate the diet, thermal modalities, self-massage therapy, parafunctional behavior monitoring. Review questions were: can self-care protocol assist in pain reduction in temporomandibular joint disorder patient? To what extent can this self-care protocol help in pain management? And with temporomandibular joint pain will reduce by adding a self-care protocol to another type of treatment? Contents of this rapid review. I actually have used Prisma flowchart 2022. First stage was review question generating, then literature review, then the records that are identified from Science Direct were 22, and from PubMed were 11, and from Google Scholar were 26. The total registers were 59. Then identify the reviews, inclusion and exclusion criteria for studies which were based on my review questions. Then screening and quality appraisal were done in the same stage that I used Brisbane 2020 expanded checklist. Finally, the studies that are included were 12. Studies inclusion criteria were full paper review, quantitative research, which included randomized clinical trial or observational studies, patient 18 or above, and studies from the year 2010 and later. The studies were excluded because of the following: articles that study temporomandibular joint invasive treatment and pharmacotherapy approaches, and studies with children were also excluded. Unrelated and unavailable full text or abstract only papers were also excluded from the review. Every study included in this review has identification card with all details as the study title, year of publication, type of study design, type of intervention, and some notes to criticizing the papers. Discussion. I have written my discussion actually in multiple stages. The first stage was the return to the review question and put it ahead of me. The second stage, I was reviewed the data results of studies which were used in this review are all quantitative in nature. These data were extracted from clinical trials, quasi-experimental studies, cross-sectional, and Delphi techniques. The resulting data from these studies were unfortunately non-homogeneous in pattern due to the fact that differences in the self-care protocol operational definitions and also the temporomandibular joint diagnostic approaches and pain scale measurements were also different. Self-care protocol is the first line effectuous temporomandibular joint disorder management techniques due to the fact that self-care component do not present as one form of therapy. Rather, it includes all principles of self-regulatory behaviors which usually influence the overall human pain perceptions. In addition to the exercising approaches, palliative treatment as a domestic self-care with medical management has offered a noticeable pain reduction at least for a short period of time, and the patient can extend the period of pain reduction by complying with continuous regular self-care strategies such as avoiding talking for a short time. Recent studies recommended deferring any type of temporomandibular joint surgery for 6 to 7 months to allow time for healing to occur. In addition, it gives the propensity to implement non-invasive management methods which may give good results in reducing temporomandibular joint pain, and the patient may not need surgical intervention. Education is slightly more effective than dental occlusal appliances in treating spontaneous temporomandibular joint muscle pain. Conclusion: self-care protocols are mostly used as initial treatment in acute phase for patients with temporomandibular disorder pain. Self-care can boost and back other temporomandibular joint management methods. In adaptive and fully motivated patients, self-care protocol can be a more effective and sufficient method to manage temporomandibular joint pain. Finally, self-care protocols have long-term positive effect on managing temporomandibular joint pain when patients comply the self-care protocol regularly and continuously. Recommendations: it should consolidate the operational definition of self-care protocol. Also, it should to consolidate the diagnostic criteria and the tools for temporomandibular diseases. It is better to include the control group in future studies as these groups provide a comparative evaluation and give us the advantage of differences between the patient and healthy subjects. In turn, this will facilitate careful interpretation of the results. Self-care protocols should include education on etiological factors, treatment options, and also on prognosis of temporomandibular diseases. Educational sessions must contain information about bad oral behaviors and how these habits can affect the health of temporomandibular joint. Behavioral changing technique must be added to these educational sessions, as it is found that the effect of educational sessions subsided after 9 months. Thus, educational sessions must be in continuous manners. Thank you.